Hey there, Dr. Hill here.
Hey, Brian, nurse practitioner. We just want to congratulate you on taking control of your health.
Yes, we want you to understand that we take our job seriously as providers. The word doctor literally means educator. So we want to educate you on why you are suffering with the ailments that you brought yourself in here for. So the term disease comes from a Latin word that means out of balance. We want to find out where you're out of balance and get your body back to balance again so it can heal.
So you're telling me that your body can heal on its own, given the right environment?
Absolutely it can. Let's help you out. We are an integrated practice. So what is an integrated practice?
An integrated practice is a little different than regular conventional medicine. Conventional medicine looks at just like one aspect of the body, or they're just focused on one part and then kind of send you somewhere else. And that's just their duty there. Here, we look at the whole picture. We actually look at the three major pillars of health, which is the musculoskeletal, the neurological, and the nutritional aspect.
Yes, so the musculoskeletal is what we're looking at here is we want to make sure that your posture and your movement patterns are in balance. When they are out of balance, your nervous system kicks in. And your nervous system is kind of like a check engine light that communicates that there is a problem. So we want you to understand that's most likely what brought you in for care is we had a check engine light come on. And so what we want to make sure is the third major pillar of our care here is the nutritional side. Understand that every single day your body makes and produces between 9 to 11 trillion cells. And those cells, think of them as houses. You're constantly building houses to replace old houses. And so we want to make sure that those cells are getting the right building materials to make nice, strong, healthy, concrete mortar cells. So we want to make sure your nutrition is up to par because we are wanting to see you victorious in getting your health back, getting your life back, and getting you out of imbalance, getting you back to balance so you can heal.
All right, so now we're into the phases of care, which are the 4 R's, which is relief, rehab, restore, and remain.
So let's start with the relief phase. So what's going to happen in the relief phase is we got to get you out of pain. So when you're in pain, you don't feel like doing anything. You're literally stuck in a cell of pain. So we're going to slowly break you out of jail here, okay? How this is going to happen is we got some very powerful passive treatments that we do to get the pain levels down. We're going to passively be working on stretching you, getting those fibers that are way too tight, the scar tissues that are too tight in your muscles, your tendons, your ligaments. We got to start breaking that down a little bit. And then we also want to make sure that the joints are healthy and mobile because that's where the body keeps regenerating and bringing new nutrition to the area, blood and water, etc. And by the end of our phase 1, which is the relief phase, we want to make sure that your pH levels are at an optimal 7.1 or higher because your hydration, your hydrogen needs to be high at this level because this is where the body makes stem cells. And the stem cells are what repair you. When you break your arm, when you tear a muscle, ligament, or tendon, or your skin, it's stem cells that regenerate you. And we'll talk more about that in your next phase. All right, we reach now phase 2. Phase 2 is the rehab phase. In the rehab phase, what we are trying to achieve during this time is we want to continue to be working with lengthening tight muscles. We want to be basically strengthening muscles that are getting weak. We also want to maintain the health of the joint. So we want to make sure that the discs are healthy. We want to make sure that the joint spaces that you may be experiencing arthritic changes or degenerative discs or injured discs like bulging, herniating discs, or we might be dealing with cartilage loss in knees and hips and shoulders. We want to make sure that we start rehabbing this. So we started with a passive care plan in phase 1. We are now introducing phase 2 as an active phase. In the active phase, we want you now to start taking ownership of your journey of health. because our goal is to get you back to balance, but we want to make sure that you understand the power of maintaining it yourself by the time that you leave here.
So also in this phase, for people that are good candidates or want to move forward with it in this active phase, we do regenerative cell therapy, or what they call replacement cell therapy.
So replacement cell therapy, what is it? So it's the body's natural way it heals itself. So if you cut yourself and you bleed, right, your body is going to start with a response of platelets. Platelets are the bandage, the scab that gets created. Once that scab is there, the blood stopped and the hemorrhaging is stopped. Basically, the cells that come in next are the replacement cells to the damaged area called stem cells. So these are the cells that replace the damaged cell, let's say skin here, and it replaces it with a brand new skin cell called stem cells. It's the same way that we're able to heal a broken bone. It's the bone cells that gets replaced is through stem cells. So what we want to just do with this is to boost up the body's natural ability to heal through cells. So all we're doing is giving it a flood of new cells to an area of injury. So for instance, if you're dealing with any kind of cartilage loss in the knees, in the hips, if you're dealing cartilage loss in the shoulders, if you're dealing with degenerative disc disease, osteoarthritis, we're dealing with bulging disc, herniated discs, ruptured discs, if you're dealing with plantar fasciitis, if you're dealing with neuropathy, these are all things that we do to help boost healing in the body. We're just trying to get you there quicker and faster. Why is this a good alternative? Well, it sure beats the alternative, and that is surgeries that statistically are long recoveries. There's not a guarantee that you're going to be successful with this. Statistically, it's not a long-term fix. We're just trying to give you another option, another way that you can say, hey, I don't want to go on this pathway. I didn't know that I had another option here. You do. It's called replacement cell therapy. It's the cutting edge. We just want to be able to give you the understanding that we offer it here, if you're a good candidate and if you're interested in going in this pathway.
People get really excited when they hear about regenerative cell therapy or replacement cell therapy. And they're like, I want it now. I want it right out the gate. Let's do it. Let's get this going. I want to feel better. And here at CoreMedX, we don't do that right at the beginning. There's a reason why we wait to this second phase to do it.
And the reason is that one, it sets us apart a little bit. So we want to make sure that we are optimally getting the body ready for those cells to be very effective. So let's recap. In phase one, what we're trying to do is we're trying to get you out of pain immediately. We're introducing nutrition. We're working on getting your pH levels up. And then in phase two, we want to make sure that you understand that you are an active participant now in your health journey. So if you're excited and we're ready to move forward into this next phase with introducing regenerative cell therapy and you're a candidate for this, what does this next treatment look like?
So during this, it's going to be a series of 4 injections over a 4-week period of time. So once a week, we're going to do these injections. So we're going to start out with PRP, which is a platelet-rich plasma. And then we're going to come back and do that a second time for the second week with the PRP. And then the third week, we can get the regenerative cell or stem cell therapy. That's going to come in. And then lastly, we come up again to boost all that with the PRP again. So that's usually the way that it goes through there. Now knees, we do something a little different. We still do a series of 4 injections, which is still going to be over once a week. But we start out with the platelet-rich plasma, PRP. Then we come back with hyaluronic acid, which is HA. And then we come back with your stem cells on that. And then we do PRP. Now the reason behind that, we have that a little there, the HA actually sits as a cushion and a shock absorber for it. It's actually naturally in the body, and we're trying to bring that in there to help it and make it glue for those cells.
Perfect. So you're excited about the next visit. Hey, I want some more information. I got some more questions. I got some concerns with this. We are absolutely eager and excited to answer those questions for you and to give you another option rather than going in a surgical procedure.
Okay, so now we're moving into the third phase, which is the restore phase. So you're out of pain, you're starting to get stronger, you continue to get stronger, and you're thinking, okay, this is great, I don't need to do anymore. But you have to remember that when the body gets out of balance, it compensates that whole time. And that pain is the last thing to show up. but it's the first thing to go away. So now your pain's gone, but yet you're like, oh, so I feel great, but you still haven't corrected that total balance. So that's where we have to keep on going and maintain it.
Yes, we want to make sure that you are basically in balance by the time that you leave, and we want to make sure that it stays that way so that we can give you a graduation. You can move that tassel over and you can graduate with honors. So the fourth phase that we're going to talk a little bit about is it's basically our maintenance phase, but we call it our remain phase. Okay, we want you to remain in the state of healing. We want you to remain understanding that your body heals. So what that basically looks like is that we are going to teach you how to fish so you can keep fishing for yourself, but every once in a while you might need to come in and make sure that your equipment's working the way it needs to be working. So we'll talk a little bit about kind of a chiropractic treatment and so on and so forth in that maintenance phase, and we'll go further in detail when we get to that point.
We're so excited for you to see that what's on the horizon. There's been many people before you that have come through and have excellent testimonies about how this has helped them and has changed their lives.
If you do what we are recommending you do, you're going to have a testimony at the end of this. We are going to be your coaches. We're going to be your cheerleaders. We might even lend you a shoulder to cry on, but we will not do the work for you. We want you to take ownership of your health, your body, and your quality of life that you're pushing to work for in these next several months. So come with your questions on your next visit. We want you to understand that we're going to go over your x-rays with you. We're going to go over your treatment plan with you. We'll go over your insurance coverage with you. And then we'll go over any out-of-pocket investments that we're looking at here. And we want to see if we can partner with you to move you forward, to get you in the quality of life that you need. We'll see you next time.